Welcome to Wake Up Canada News. I'm Brad Wilder. Canada's COVID failure. What we didn't work. And more need to understand this. Swindled, fooled, coerced, intimidated, and lied to during the pandemic. The public health establishment misled the Canadian people about the value of masking, closures, and social distancing. No one has accepted blame or even been reviewed. Understanding how badly we failed is not only an inevitable part of the told you so process, but more importantly, a lesson for what's ahead. Now just ask the Swedes. Sweden had 0 excess deaths associated with COVID-19 for a total of 19,060 deaths. Canada had the second highest most excess deaths with 41,685, and that's the story right there. Let's take a look. The only statistic that really matters when talking about the roughly 2 years of pandemic is excess deaths. Deaths beyond the usual couple of million that occur every year. Sweden, they had 0 excess deaths. Since the start of COVID-19, an estimated 40,349 more people died in Canada than expected, says the country's vital statistics agency. Now, the unexpected deaths, they represent a 7.4% increase in the number of people who died across the country if the pandemic were never to have happened. This is all according to an updated data released by Stats Canada. Now, excess mortality measures how many deaths actually occurred compared to what was expected under normal circumstances. It's the one way researchers have been able to figure out the true number of lives lost due to COVID-19. Now, last month, the World Health Organization reported the number of global excess deaths during the pandemic had climbed to nearly 15 million. Over that same period, only 32,490 deaths were directly attributed to COVID-19, a gap Statistics Canada researchers say could be the result of indirect consequences from the pandemic, such as delayed medical procedures, increased substance use, or declines in deaths from endemic diseases like influenza. Now, Sweden, they did very little in terms of halting work and school or forced masking and even social distancing. Canada, though, we were a total lockdown. Canada still demands a COVID test for entry and the filling out of the WUCN-Epi app, including for its own citizens. In addition to leaving our economy in shambles, well, Canada's COVID strategy apparently did not consider the age disparity in excess deaths. Globally, most COVID deaths occurred among persons aged 77 and older. People exposed to COVID in their 70s have twice the mortality rate of those exposed in their 60s, and 3,000 times that of COVID-exposed children. But everyone was made to wear a mask as though everyone were at risk, equal risk. And without solid evidence that mask mandates significantly lower viral spread even in the community. Age-specific solutions were needed for a virus with new age-specific effects. We ignored or overlooked the data. We are paying for that mistake now. Saving lives or saving the economy? Both, please. Just ask the Swedes. It was also exacerbated by Canadians' underlying health. Our underlying health woes are exacerbated by income inequality and high rates of poverty and maddening levels of obesity, diabetes, and deaths of despair. Whatever we did, whether we masked, locked down, or stayed open and maskless, we still would have suffered because of these underlying issues. Fixing the next pandemic means fixing Canada first. But that's for another show. I'm Brad Wilder. Thanks for watching. This is Wake Up Canada News. I'll see you next time.